of day one in the DHIS2 or HISP Asia Conference. So today we have a slightly different topic compared to what we have discussed throughout in the day, because this session is going to be on DHIS2 for education and DHIS2 for school health. So we are planning to cover a bit of a wide variety of topics in this session. So as you can see here, in the first 30 minutes or so, we will give an introduction to what DHIS2 for education and EMIS is. And if time permits, I know we now have limited time given we had extended tea break. But if time permits, we will do a brief demo of what we have at global level. And followed by this, we have one country use case from the region, which is from Sri Lanka. And then finally, we have a session on DHIS2 for school health. So that's what we are planning to cover, given that we have now roughly around 75 minutes more. Let's quickly jump into the first topic, which is on DHIS2 for education and EMIS. Right, so I'm Pamod Damarakon, representing HISP Sri Lanka, and we have two other colleagues who will be presenting today on the Sri Lanka country example, as well as on school health. So they will do the introductions in the respective sessions. All right, so let me first of all start with the concept. There is a concept called digital public goods. Is it something that you all are familiar? All right. If so, it's great. If not, in fact, this is one of the trending terms which is promoted by the United Nations right now, because we are all living in a digital era, right? So in this era, whatever the countries used to do in day-to-day government practice, whether it be in the health domain or education domain, things that we used to do related to data. Good old days, we used forms, paper forms, but now we are using digital technologies for most of them. So the thing is, now when we consider the global perspective, most of the developing countries are using a new technology, which are digital technologies in collecting and use of data. And one challenge we have is how much of control the countries have with related to production and sustaining of these technologies. And the thing is, more and more dependency we have on digital technologies, whether at some point of time, whether countries will not be able to sustain and continue this work because they have some dependencies on some proprietary solutions and all that. So with all that, there has been a high-level discussion at UN level where this concept of digital public goods has come up. So the objective let me come up with the, let me mention you the definition of digital public goods. So these are open source technologies, open standards, open data, open AI systems, and open contents that adhere to the best practices related to privacy and applicable laws. And basically, these technologies are directed towards countries achieving SDGs. So the basic recommendation right now is for countries to use this DPGs, digital public goods, as much as possible in achieving or driving their policies and practices in achieving the sustainable development goals. So now, when you introduce a new concept, how can countries know what are DPGs? So to support that, the Digital Public Good Alliance maintain a registry. So you can access the Digital Public Good Alliance website and go through this registry to identify what are the different digital public goods which are there for each domain. And we have this one, DHIS2 is one of the key digital public goods which are identified and listed for supporting SDGs, especially for SDG 3 and 4. Right, so SDG 3 is for the health and 4 is for education. So I just wanted to mention this as a concept. So we have this common platform DHIS2, which is supporting both education as well as health domains, right? So, okay, with that definition, I want to present to you this map. Again, given this audience, I don't want to mention how widespread DHIS2 is. So these are the countries right now where DHIS2 is being used, mostly in the health domain, right? So we have more than 100, it could be even more than 120 countries with the NGO and donor implementations. who are using DHIS2, right? So we have mostly the developing countries, as well as we have some developed countries like Norway itself who are using DHIS2 globally. So DHIS2 for education is something relatively new. So DHIS2 has been used in the domain of education for last 5 years. So right now, these are the countries at global level who are using DHIS2. So we have some countries who are at the moment using, and some countries who have expressed interest. So the interesting thing is most of the countries who are using and shown interest are right now in Africa. So the only country we have who's using DHIS2 for education at the moment in Asia Pacific region is Sri Lanka. So that's one reason why Sri Lanka team will be presenting on what they are using DHIS2 for the education. In addition, I know like there are some discussions we have had within the HISP community. For example, Pakistan was interested at some point of time. So that's why we wanted to have this session so that we can promote DHIS2 to be used in the education sector in the Asia context. Right. So again, DHIS2 is the largest HMIS or Health Management Information software or system in the world. So the HMIS stands for Health Management Information System. So so the thing is, it is a MIS, Management Information System, right? So because DHIS2 is a management information system and it is a generic platform, meaning there is nothing so specific to health domain that you have in DHIS2, you can easily use this MIS in other domains as well. So that's why when it comes to the education domain, we want something called Education Management Information System, which we abbreviate as EMIS. And this is the definition of an EMIS as per UNESCO. And when you go through this definition, you will see that this is very similar to the definition that we have for the health sector as well, right? So it's a system for not only collection, it's about data collection, integration, processing, maintenance, and dissemination for decision making, right? So this is a requirement that you have when it comes to the education sector from a management information system. Right. So just like health, even in the education sector, when you consider countries' development, before 2015, when we had MDG, so Millennium Development Goals, the focus was more on something called EMIS 1.0. So what we mean by EMIS 1.0 at a very simplistic level is like you want to understand data as aggregate, right? So the counts and all across the countries, across in different schools, different grades, for different education related implementations or interventions. So the thing is like we want to know like how many students, right? So all the statistics related to how many students, so aggregate. But right now, when we are targeting achieving sustainable development goals, we have more focus on individual level data, meaning we want to know like what happened to individual students, right? Or else what is happening for the individual teachers. So one thing we must emphasize when we talk about education management information system, we talk not only about at individual level, not only about students, we also talk about teachers. So right now with the EMIS 2.0, the focus is more at individual level. But having said that, we have to start somewhere in a very simple, sustainable way. So it is a good practice to start with aggregate data, right? So globally, as the HISP and the University of Oslo, over last 5 years, we have had some DHIS2 for education projects related to some grants. So these are some of the projects that are highlighted here, especially the one related to the NORAD and the GPE have been very instrumental in driving countries adopting and using DHIS2 in the education sector. So for example, the only project that we have in Asia, which is in Sri Lanka, was supported by this NORAD project. But right now we are also interested in more and more donors in the Asian region to join with us in supporting the countries and supporting the drive, because this is not only country implementations, we are talking about how DHIS2 for education can evolve, because this is a new domain where we are using DHIS2. Right, so let's discuss of some of the use cases at very brief level. So First of all, we are using DHIS2 for educate. I mean, we are using DHIS2 in the education sector for planning and resource allocation at national level as well as district level. So again, like some of the screenshots that we have are from both Africa and Asian regions. So it is a mix. This is a very simple use case we are using DHIS2, right? Just like in the health sector, this is more about we collect aggregate data and we can use this data in the form of dashboards, visualizations for simple decision making at national and district level. In addition, something again connected, we are using it for routine data collection and reporting. So there was this implementation called Termly tool, which is implemented in Uganda, but even in many other countries, including Sri Lanka plus other countries in Asia region, we have this, right? We call it like school annual census, where we want to collect different resources which are there in the school and aggregate data of teachers and students. And in addition, because we already have some data collected in other platforms in the education domain, when we talk about use of DHIS2, there are a lot of import, exchange, integrations also which are happening. So we have one major implementation in Togo related to integrating StatEduc platform, if you are familiar. But in all the countries that we are going to implement DHIS2, these are not green fields, meaning there are existing systems with which we have to be interoperable. Right. And then, of course, again, some screenshots and processes around integration. So again, we'll be sharing all these slides, so I don't want to go into too much of detail. But this is something that we have to work with, because this is a field where you have so many other systems which are currently operating. Right. And then if we talk about use cases cross sector, so we talk about not only education, and this is also linking somewhat with the school health topic that we'll be covering today. We have use cases related to vaccination campaigns and school feeding program. In fact, Pramil will be talking about the school feeding program or school meal program in Sri Lanka in his use case presentation. And we also have school health surveillance data. So especially during the pandemic, when we were talking about going out of the lockdowns, opening up schools, this was something very useful, where we needed to have synergies between like how much of cases are present, so that you can use this data to take decisions on when we can open up the schools. Right. What you are seeing here are the different tools available or different solutions available in DHIS2 for supporting education information requirements. So primarily we have the default or standard DHIS2 applications for capture of data, like we have the mobile and web data capture, both for aggregate at individual level. This is like out of the box that we have in DHIS2. And in addition, we have the DHIS2 standard dashboards, which are already there. And then we have a very specific application, a custom application, which is produced by the University of Oslo, which we name as SEMIS. But then again, like it's a generic name. But for countries, when you are implementing, you can use whatever the names. This is the application we are using for collection of individual data of staff and students. So I will try to do a quick demo of that application as well. It's a custom application produced and maintained by the University of Oslo together with support of different HISP groups. And in addition, we have different custom applications like the school report card, daily attendance app, and so many other different dashboard applications produced by the HISP groups supporting the ministries of education. Right. So in very simple terms, one main use case that we have is collection of aggregate data and visualizations. Right, that's a very simple, very common use case that we have in all the countries. And the next use case that we have is to collect individual level data and analyze it. So to support that, we have this application which we call SEMIS app. Right, so these are the two main examples that we have, and I will try to do a quick demo of both components, the aggregate dashboards and the data collection forms, as well as the SEMIS application now. Right. Before that, I just wanted to mention you our approach as the University of Oslo and the HISP network. So here we take a more scientific research-based approach. So we have a team at University of Oslo, including the academic staff and some PhD students who are researching on EMIS. And together with the master's program, they come up with recommendations on how EMIS should be implemented and what are the learnings from these implemented countries. And based on that, we do the development work related to this EMIS application and different DHIS2 functionality. So primarily, like again, another classic example. I mean, this entire effort is a classic example where the HISP groups from different regions are collaborating in supporting countries. So we have HISP groups from both from Asia and Africa working together in developing the application as well as supporting implementations. Right. So some prerequisites, just like in the health sector, before you start implementing DHIS2 in the education sector, you need a lot of stakeholder buying in, right? Without stakeholder buying in, you are not able to decide, like, I mean, if you just try to introduce something that they don't want, it will not sustain. So that's very crucial. And you need to have primary documentation. So if they have some existing data entry forms and SOPs, you need to get hold of them. And you need to make sure that you have dedicated human resources at all levels. And again, this requires a lot of funding. So there has to be, along with some stakeholder buying in, you need to have donors on board, or the country government commitment has to be there in, like the basic infrastructure. So these are IT infrastructure. In addition, to continue capacity building, because in education sector, our experience is compared to health, there are some challenge. There is, I would say, slightly lack of funding in most countries when it comes to ICT or information systems implementation. So this is something that you have to consider. And also you'll have to also think about what you are going to do with the legacy data, right? So it's not that the countries are starting fresh with the DHIS2, they will always have some other means of collecting data. So how are you going to deal with that data? Are you going to import, or how you are going to connect? And then, of course, other typical issues related to information systems, like, do you have unique identifier? How do you identify one student from another? How generic these identifiers are, or are they very specific to a school and they can't use it somewhere else? So these are some common challenges that you will have to consider. Right. So regarding support, we have the DHIS2 community, which you already know. This is a virtual community that we have. And in that one, we have a separate section for supporting EMIS and education. So you can already see there are some queries and topics there under the education category. So you can ask if you have any clarification and get support. And in addition, we have the HISP group supporting this EMIS implementation, just like any other DHIS2 implementation. So right now in the Asia region, it's mainly the HISP Sri Lanka group. But one idea of we having this topic is to promote more and more education implementations across the countries, so that there can be more, we can also streamline the support for the countries in the region. Right. So some of the success factors in our approach, this is very generic, like this is the same success factors for the DHIS2 implementations in the health as well. So we are taking a platform approach, like we are not just trying to invade or infiltrate DHIS2 into an ecosystem and disrupt the ecosystem. We try to coexist and take this platform approach. And the feature prioritization is more like a democratic process. So countries and the HISP groups can vote for the features. We have a lot of sharing and networking. And what we thrive to do is to build country capacity. So when we hear from Pramil about Sri Lanka's approach, the Ministry of Education's approach, one key thing is they wanted to build ministry country capacity so that there is less dependency even on HISP to sustain in the system. Right, so that's our recommendation, and of course, whatever we do is based on research. So this is not research based on the data you collect in the system. It is more about implementation research, what we learn by setting up and implementing systems. Right. Okay, so before we move on to the country use cases, let's see how much of time we have. Yeah, we have probably around 5-7 minutes where we can try to do a quick demo. So let me stop sharing briefly, and then Okay. Right. So yeah. So what you are seeing here is our demo instance in DHIS2 for education. Again, you also can use it. So I have already logged into the instance. So the first thing I'm going to do, but because it's been a while since I last logged in, I will try to refresh and see whether I'm still logged in. So that's a kind of a standard good practice when you are using DHIS2. All right. Okay. Yeah. So as I mentioned in the morning in our new features demonstration, we have not just one dashboard, we have several dashboards, right? So when we look at these dashboards here, you can see like the data is related to different categories in the education sector in school level. So we have one dashboard for the pre-primary, and we have for primary, lower secondary likewise. Okay, so if we look at some typical indicators that we have in our EMIS or education management information systems, based on this dashboard, we have data related to learners. So some of these indicators that you see here, such as gross enrollment ratio, net enrollment ratio, and the data related to absenteeism, right? And of course, even having maps so that you can get at a glance view of what are the different levels of gross enrollment ratios across the country. As you can see here, this data, of course, is coming from a demo instance that we have in Gambia. And then we also have these kind of tables with applied legends. So you can see at a glance how each of how the data, like what is the like level of, for example, you see like because we have applied a legend, what are the regions which are performing good, and what are the areas where the reporting levels are not so good related to that indicators. So likewise, we have learner related data. And also we in these dashboards, we are collecting data related to the staff, such as pupil qualified teacher ratio, and then the trained teacher ratios and things like that. And in addition, we also have this dashboard catering some indicators related to infrastructure. So the thing is, like, it all depends on what the country requires. So what I'm showing is based on the inputs that you have got from most of the countries. So when you look at a particular number of grades, these are the key data that most of the countries are requiring, but you can cater it based on your country requirements, right? So this is where we land in when we log into the DHIS2. And in addition, as I mentioned in the morning, we can drill down. So for example, while this is at the country level, we can always drill down and see. Okay, let me get rid of this. Yeah. We can drill down and see, like, not at country level, but if you just want to focus on the region, we can quickly drill down, and this dashboard will be appearing based on the data for that region only. So this is ideal, just like in the health sector, for conducting a desk review. Okay. All right. You want to give it here? Right. Okay. So now that we have seen this dashboard, let's see where this data is coming from. So to do that, what I will do is I will quickly open the data entry app. Right. So when we open the data entry app, we'll be able to see the standard data entry applications. So let's look at the different, thank you, different data entry forms that we have in our demo instance. So if here I can select a school. So I will select this Albion LBS school. And once I do that, I'll be able to see the different data sets which are available. So for example, a common data set or data entry form that we have for most of the countries is the school annual census. So let me just open school annual census for the year 2024. And this, what you are seeing here, is a sample school annual census form. So you see, like, we collect data related to general information and class and enrollments, and here related to textbooks and guides. So these will differ from country to country, but what I wanted to highlight is when we create an aggregate form like this and ask the schools to enter data, based on the data that they enter, those dashboards will be populating. So you can nicely use the data. I mean, you will have to implement with SOPs so that the schools will know what is the frequency they are collecting data, and once they collect data, you'll be able to analyze and visualize it. All right. So there are a few other forms, so I don't want to go into detail. We have one related to daily attendance. So let me select yes, okay, maybe 26th, and then morning. I mean, this is a very simple data entry form, right? So again, it depends on country context. So whatever the use case you have, you can easily create a DHIS to aggregate form and start collecting data. Okay. Given the time, I quickly want to show you the individual data entry application that we have, which we call SEMIS. So let me quickly open the SEMIS application. So this is SEMIS application, and this is what it looks like. So this application, what you are seeing here, is a DHIS2 core application for education use cases only, meaning you will not use this application for health implementations, because this is very specific for education data entry. Why we have a separate application is because how the education domain is like. Because in education domain, unlike health, most of the operations are bulk, right? So when you take attendance, you try to take attendance in bulk in the school. So this application supports a lot of bulk data entry. So this is mainly for data capture at individual level. So currently this SEMIS application supports enrollment, or you can say registration of children, students, and taking attendance, performance, final results, and transfer of students from one school to another, right? These are the supported features. And in addition, when it comes to staff, it's a staff registration, attendance, and transfer. So we have a feature list for this for the evolution of this application, meaning like what are the features that we are going to include in the application in time to come. So at the moment, this is what we have, but we have a roadmap. So I will quickly show you how the enrollment works. So I click on enrollment, and then I need to select a school because I have logged in as a national level user, just like any other DHIS2 application. So I will select the same school, which is Albion LBS, and then I will select a grade. So let me select, for example, grade 2. So right now there are no students, but for example, if I select grade 1, if there are existing students, it will list out. And here again, I can filter the students based on the grade as the class as well. So for example, if I select class A, you will see the list is getting shorter, right? That is because it will only filter out the students from grade 1A of Albion school, right? So I can do a registration, or we call it enrollment. So I can click on enroll student, and then this is a very basic data entry form that you get, right? So I don't want to take time on entering data, but it is a standard registration page that you will always see in health sector as well. So once you do that, the student will be registered, and then when a student is registered, we can take attendance as well. So when I click on attendance, in here, okay, yeah. So I have option here, take attendance. So when I click on take attendance, it will ask for which day. So for example, if I want to take attendance for the 26th of September and I click OK, what will happen is you will see a menu like this. So this is supporting bulk data entry. So for example, if I have like say even 10 students, I can always quickly click present or absent. So I can, for example, click here, this student was present, and I can click this one was absent. So the moment you click on absent, it will ask for a reason. So we have some two common reasons listed here. I will select sick, right? So likewise, it supports bulk data capture. One example is attendance, and I can also weave attendance. So if I go here and I click on 26th, it will support weaving of attendance for the entire week. So you can see here the attendance we have taken for those two children for the day of 26th. Right? Yes. Sorry. Question? Yeah. Please. Yeah. Yeah. Exactly. So this question we have this is a common issue we have even in the health sector as well. How to tackle holidays? So we are in the process of incorporating and configuring holidays into the SEMIS application as well. So we have a roadmap. This is again a requested feature. So we are planning to incorporate that so that like it aligns more with different procedures that you have in the schools. Yes, please. Yeah. Yeah. Calendars, yes. Yeah. Yes. So for the benefit of online participants, because they could not hear the question, so one question also related to the holidays, how to address the issue of holidays. So I mentioned the SEMIS application in the roadmap. We have already identified that as a requirement. And the other question was how to incorporate different calendars into DHIS2. So this, of course, has been supported for very specific requirements. So, for example, I know like Nepal has a calendar requirement, very pressing, and then also Ethiopia. So, for those countries, there have been different approaches that have been recommended, and they are using them. But as you correctly suggested, like from a like front end, selecting those calendars and all is something that we will try to. I mean, we have to, yeah, date conversion, yeah. Yeah, duly noted again. Yeah, Adnan. Yes, so the weekends, yeah, weekends are like as you can see here, the weekends we are already considering, but like your requirement is very specific, like how to mark different like country specific, or there's also a requirement like because you have some regional implementations, like what if for that province only they will decide we will close the school on this day. So how to incorporate those? So yeah, weekends we are like supporting here. For example, if we yeah, you see like Saturday Sunday you can't enter. This is actually the custom application, so we have better control over like configuring things here. So that's why you don't see something like that in that, for example, capture application. Yes. Yeah. Of course. So duly noted, like this is a holiday and localization, especially localization, as I mentioned, like now requests are coming to localize at more granular level, not even at national level. So duly noted that features. Okay, so the question is related to the access control of this system and whether individual students are having access. So here, because we are talking about EMIS, just like HMIS, when we talk about HMIS, it's mainly the health staff who's entering data. So due to that, because in this EMIS implementation, we are currently managing most granular level that we are giving access is at school level. So I mean, simple answer is here we are not giving any access to the individual students. It's at the school level only. But yeah, yeah. Yes. Yeah, very good question. So the question is related to the access control of CMS application and the troubleshooting. So again, now this demonstration is the generic CMS application in Sri Lanka context, which Pramil will explain more. They are not yet using the CMS application as a, I mean, they are still considering, because again, when we try to localize to country context, this generic application will have to be changed a bit. So they are still in the process in Sri Lanka of configuring, identifying that. But when it comes to our generic recommendations at the moment, because I mean, we have to see the practicality, because like we talk about schools where you don't even have a proper IT person who will be taking care of, you know, like implementing this system. So when we look at our countries, we will have some national level reputed schools which will have a lot of resources, but some schools, they won't even have a computer. So given that in most of the countries we are implementing at, you know, like at large scale, we are trying to start simply in a very simple way. For example, you will have one focal point for, you know, like at school, it may be one or couple of them, maybe one per grade, who will be taking care of entering data. No, I'm just saying an example. Yeah. So what you are asking is like whether, for example, class A teacher will have access and all that, right? So yeah. So that again, we probably will be able to restrict configure that, because this is a custom application. But at the moment, we don't really have any country who's going into that level, because most countries want to start at a very simple level where we won't really have schools, I mean teachers, individual teachers having access only to that school or only to that class. But it's up to the countries to decide. They can start at a very simple level and scale it up. Yeah. Mhm. All, yeah. Yeah. Yeah, and the other thing which which I didn't have time to share is like when you, I mean, this is a very generic statement. When you compare the health and education in most countries, uh, the amount of capacity, human resources, and the funding that we see in the health is not always present in education. So sometimes the use of data and the culture around it, like you have to put a lot of effort into that when you are implementing EMIS. So given that, our recommendation is to usually start slow and with limited scope, so that people will be more familiar with the systems and the workforce first, and then we can build on that. Right. Okay. So right, I don't think we have enough time to go through all the features that we have in the SEMIS application, but I just wanted to highlight right now we have, for example, yeah, right. So as I mentioned, sorry, there's issue with the internet. Yeah. But as I mentioned, right now we are supporting for students taking attendance, performance, like it could be like the marks that you are getting at exams and the final grade transfer. And for the for the teachers, we are supporting taking attendance as well as transfer. So these are some basic requirements that we have identified across countries, which are there in the SEMIS application. All right. So with that overview, let's go to a country presentation or a use case. So let me invite Pramil Lianage from Sri Lanka. Again, he's representing the Ministry of Health Sri Lanka, but he has also been involved in supporting the Ministry of Education as well. So that's a kind of synergy we are trying to achieve at country level. So if Health Ministry already has capacity, they help out and collaborate with the Education Ministry in building systems. So over to you, Pramil.
Right. Good evening, everyone. So thank you, Pramod, for the introduction and the detailed explanation. So I'll walk through what Sri Lanka did quickly using DHIS2 in the education sector. So I'll start from where Pramod stopped, the SEMIS app. So clarification, we are not still using the SEMIS app completely in Sri Lanka. We are trying to pilot that. But apart from that, we are using DHIS2 in the education sector as a management information system, which I will briefly discuss. All right. So I'll briefly outline the education structure and what has been happening and what are the things we are using at the moment, two special modules which we have implemented. So this is the outline of the education system administration. This is mainly the government sector. We are not still using for the private sector most of these things. So we have a provincial setup, and under that provinces we have a zonal setup. So each province will have zones, educational zones, which are different from the administrative districts. So under these zones, there are divisions, and also under that we have about 10,000 schools in Sri Lanka. So the total number of teachers is amounting like 241,000, and then schools also we have national schools and provincial schools with the and about 4 million students in these schools. So what has been happening was there were attempts to use certain systems for education, one in 2012 and another student information system in 2017. So, but these systems were not maintained properly especially because of technology and also the capacity of the Ministry of Education to maintain these systems. So, and also the varying requirement. So they're coming up with new requirements, and the previous systems were not able to cater these things. So they needed some solutions, and they looked at what we have been doing in the health ministry. So they have seen all the success stories of Ministry of Health using DHIS2 in different programs, and also the capacity of Ministry of Health and also the support of HISP Sri Lanka in using DHIS2, and also, as Pramod mentioned, the global examples where DHIS2 has been emerging as a solution for education. So the Ministry of Education then reached to Ministry of Health to support, to explore possibility of using DHIS2 for education. And so what they wanted is in-house solution where they have the capacity to develop this system and to manage this system because of the previous experience of failures by outsourcing and getting systems done by others. So we took a different pathway. So we trained them. So this is a photo of what we have been doing. So officials from Ministry of Education, the IT people, the IT department people, so all of them were trained on DHIS2 for different roles. So from customization, then instant handling, and then usage. So all these components, they were trained thoroughly, and the instances were installed in their servers, Ministry of Education servers. So 2 instances were installed, one for training and one for production. And then support was taken from Ministry of Health and also the Committee of Practice of Sri Lanka and also HISP Sri Lanka. So what are these components we have developed? So basically this is for administrative purposes we have started with. So these are the components which we started with. One is we did a survey, like a sample survey of school level attendance. Then there's a teacher card information management, and also then there was a requirement to get the student counts, and also I will describe this in detail. So there was another monitoring and evaluation framework planned by the Ministry of Education and dashboards. So I'll go through quickly one by one. So the school level student attendance, so this was actually a requirement which came after this pandemic caused a dropout in school attendance. So they wanted to actually identify what is the stage of this dropout. So in a sample of over 2,000 schools, there was this survey was conducted to check how much this dropout rate was after the pandemic. So this was like a small study. Then for the teacher card assessment, so the Ministry of Education didn't have a proper database to identify the teacher card. So all were paper based. So they wanted to digitalize this system. So an aggregate report was customized in the system. So school level teacher requirement was taken annually for each grade, each subject in all three mediums. We have Sinhala, Tamil and English. So all three mediums, the teacher, existing teachers and the cadre was captured in this system. Then the student count. So this was used to calculate there's a ratio which each teacher can attend to students. So this ratio was used, and this to calculate the student vacancies for each year, how many students they can take in and how many teachers are available, so that you can compare whether the teacher requirement is correct, which we got from. So this is another data set we have customized. And this is currently being developed a monitoring and evaluation framework for education. So this has 62 different KPIs which have been finalized, and this is also expected to capture in the DHIS2 system. So these are the dashboards. So each year now the teacher cadre is finalized using this system. So how did we ensure sustainability? So human resources was a big challenge. So data officers were identified from each institute, that is from provincial, zonal, divisional and school level. All 11,000 people were trained. They were given some IT training and online, and an e-certificate was given. And apart from that, system was trained separately using TOT methods. So that is about school administration, and this was another special requirement. So again, after this recently happened financial crisis, then there was an issue with the nutrition of the students. So because of this crisis, actually there were reported incidents, even students fainting during schools, because when you inquire, some of them didn't have breakfast at home. So we had to, the ministry and the government plan to reactivate this school meal program, right? So initially they decided to give a meal to all the students below grade 5 in all the schools. And also if the schools are small, there is less than 200 students, or for all students, all grades. So they needed a system to monitor the progress and outcome of this system. So since they have been already using DHIS2, so they needed to customize this system, and with the help of Ministry of Health and HISP. So these were the basic requirements to check the coverage of the program, school meal provision coverage. And there was a component for financial monitoring. And then for these meals, there were another group involved. Those were the suppliers. So each school had their own suppliers. So they had needed a method to manage these suppliers, and also to check the impact of these school meal programs, because a lot of money was spent on this program and they wanted to check the impact. So these were the components developed. So there was a monthly return from school. For each month, they have recorded how many students attended in each grade, male, female, and then how many of them were given the meals, and also the quality of these meals. So all these aggregate data was recorded in the system monthly, and also the expenditure, like how much was the expenditure requested from the school, and the financial authority, so that was about the school. So how much was uh, authorized from the zonal officers and how much money was received from the donors. So all these kinds of financial data was also included in the system, and also some annual student registration data, how many children, male, female, and what type of classes, what are the grades. So those kinds of annual data was also included. And to measure the impact, there is a plan to have an annual survey of each school. So they will monitor especially the BMI. So this will come later. So now we have a baseline. So after that, sometimes whether there is an increase in the nutrition status of the child. So whether we don't know whether it's directly related to meal program, but whether there is any impact on that, and also the performance, school performance, and also there is a zonal officer who will monitor, who will go to the school and monitor the quality of the meal, like a survey, and also a separate module for supply management. So these things are currently being developed. So how is the implementation? So each school will have a committee. They have already assigned committees for school meal program and one teacher in charge of this program. So that person is the responsibility, has the responsibility to implement this program. And we initially had stakeholder meetings. So this included Educational Ministry, Health Ministry, the donors, the Presidential Secretariat. So all these stakeholders were involved in the system. And data entry was done by an identified school officers. So most of the schools had a person who has computer literacy and who can enter data into the system. But if some schools, they don't have facilities, so the zones will facilitate that data entry, and zones will have the authority of monitoring and authorizing data. And the same system was used, the same DHIS2 instance used to customize this system, and training was conducted. So we have trained the zonal officers, and they have in turn trained the school officers. So it's collaboration with the President Secretariat and Ministry of Education, Ministry of Health, World Food Program, HISP Sri Lanka, and many other donors were involved. So these are some screenshots from the system. So you can see different languages, Sinhala and Tamil, also included in the system. So what is the way forward? So a lot of requirements after seeing this system and what DHIS2 can do, there are a lot of requirements coming from the Education Ministry to provide support. So they want like school profiling, then infrastructure management, then individual data which can be managed by semis for teachers and also for students, and especially data exchange with the existing health data. So health system, they already conduct school medical inspections at certain grades, 1 for 7, and already data is existing for those grades. So when we are using the existing data, we can easily track the progress of impact of program. And then student attendance tracking, which Pamod showed using the SEMIS app. And then teacher human resource management. So that is also currently paper-based. So they want to automate that also using the cadre projections through the system, and then build the capacity of the teachers and other staff in using this system. So because now they own the system, so they are coming up with all these requirements because they know that they can develop this system, they have the capacity, and they know it's reliable. So this is what has been happening in Sri Lanka so far. And thank you very much for listening. So I will hand over to Pamod to conduct.
Thank you, Pramil. Again, like if you have any questions, maybe we can take up after the next session. So yeah. So the final session that we are going to cover in this DHIS2 for education and school health, of course, is this broader session on school health. So again, like there are a lot of synergies between DHIS2 for education and school health. But again, we are talking about school health, meaning like there's a lot of health involvement in that. So let me invite Priyanka Senanayaka from his Sri Lanka team to share with us like some generic concepts around like what is school health, and also share some of the implementation experiences based on two countries, I think Sri Lanka and Timor-Leste, right? Over to you.
Okay, thank you very much. I am moving a little bit away from the concept we discussed so far, which is DHIS2 for education. So this is a little bit different. So I am going to discuss about DHIS2 for school health, DHIS2 for education versus DHIS2 for education. So not big differences, but there's a difference. Obviously, the DHIS2 for education is not limited for school student information. That can consist teachers' information, environmental information, absenteeism, and even their marks, performance, everything. But DHIS2 for school health is basically focused on health. So that is usually managed by the health domain, while DHIS2 using for education, EMIS, are usually managed by the ministries of education or education people. So that is the main difference. And main purpose of using DHIS2 for school health is generating health-related indicators. But in contrast, the DHIS2, when it comes to the education domain, so they may generate more and more indicators, may include some health-related indicators also. So that is the difference. School health basically is a comprehensive approach of aimed at promoting and maintaining physical, mental, and social well-being of the school children. Apart from that, another component is also there, that is the environmental and safety, school environment and the promoting safety environment for the children. So these are the key areas of school health assessment in general. So I'm not going to discuss all these in very detail because time is very limited now. Main key areas are diseases and disabilities, nutritional states. So maybe some countries collect all these data. Maybe some countries are collecting just few components of all these components. Immunization coverage, we know in the school age, most of the countries are giving DT and HPV. Health education, which is very important. Mental health screening and referrals. School environmental and safety health, safety related matters, and in most of the countries, micronutrition and deworming activities. So why we are promoting or we are recommending DHIS2 to be used in managing this health related data in the schools? There are so many reasons you can think of. I have listed very few. So being a comprehensive data management platform, so DHIS2 can cater the requirements of school health programs. And it has improved monitoring and evaluation capacities using advanced analytics and enhanced reporting and visualization, ultimately, which lead to better decision making based on proper data. When we discuss about benefits of using DHIS2 for school health, so what are the benefits we can get from DHIS2 by using this for school health programs? Enhanced data accuracy and reliability. So DHIS2 has inbuilt data quality improving mechanisms so that we can rely on to have rely on DHIS to have very accurate and reliable data. And real-time monitoring and decision-making being online platform, improved resource allocation. So data is the key to take decisions on resource allocation, and also facilitated reporting and compliance. Finally, empowered stakeholders with accessible data. So these are the expected general facts of benefits we are expecting from DHIS2 when we are using for school health. Different countries may use different approaches to capture data in a school health information system. So I have illustrated three very simple examples. Maybe data capturing through paper-based forms. Initially captured in a paper-based form with some aggregation or without, then transferred to the DHIS2 or captured to the DHIS2. Mobile capture, or maybe some integration with existing systems. So are possibilities. Also with some regular data collection processes or time-to-time school-based surveys. So those are the possibilities and practical scenarios most countries and most regions are using to capture school health data. Challenges in managing school health with DHIS2, not only in DHIS2 when it comes to school health. So we have a lot of challenges which are very specific sometimes to the school sector. So data collection issues are very challenging. And you know, sometimes compared to the health sector, the schools are sometimes even far behind when it comes to resource availability in some of the areas at least. So that is a very big challenge. And even though we have data, then poor data utilization, not using data adequately is another challenge. So I'm just listing out very important ones, but obviously you can, when it comes to practical scenarios, you can think of, hundreds of challenges. To overcome challenges, we have to have a plan. So capacity building, well-planned programmatic capacity building is kind of a key to success of a school health program. And providing technical support continuously and addressing resource constraints adequately to provide minimum resources which are required to maintain the information systems, and also promoting stakeholder engagements. So these are the main areas we have identified as solutions for challenges. Actually, even before you encounter the challenge, you have to have this plan. Otherwise, anyway, you will end up with some difficulties in implementation and ultimately failure in implementation. Then in next 5 minutes, I am just running through very simple 2 examples, country cases. One example from Sri Lanka. So that is ERHMIS school health. ERHMIS stands for Electronic Reproductive Health Management Information System, which is a DHIS2 based holistic approach for reproductive health. The school health is a module in that comprehensive system. Data flow in Sri Lanka school health is bit complicated. Why? So they had a well-established paper-based data flow for about like 35-40 years. So we optimized the data flow while adopting the existing paper-based data flow. So they had mainly 3 arms of capturing data. The annual school health survey, so which is a big survey which is conducted annually to assess facilities, environmental things, everything. Then school medical inspection. So that is the medical inspection conducted by the health staff annually for selected grades. In Sri Lanka, it's grade 147. And again, monthly statement. So based on the school medical inspection, this is a kind of a follow-up activity. So those are the three main data generation points, and they were captured into the HIS2 system. These are samples of those three data flow or data capturing forms. So in school health survey report, so main data categories are information about the school, health and dental units, and water and sanitation, waste and school premises, that is environment, food and hostel means if there's a hostel, yes, and health promotion activities conducted in the system. School medical inspection, total number of students and examined, and in Sri Lanka they are capturing around 35 main health problems related to students, because a medical team is conducting this school medical inspection, it is possible. And also finally referrals. Then in monthly statement of school health activities, health promotion and education programs, and school medical inspection follow-ups, immunization and micronutrient and deworming activities were captured. So those are the basic categories of data which have been captured. Then they are generating these dashboards from school to zonal, district, provincial and country level. So these are few examples of dashboards. I'm not going through all these dashboards. I think you can go through the dashboards once you get the presentation. And the second case study is in Timor-Leste. This is actually not 100% implemented yet. This is being, I would say, about to pilot, like, customization part is almost finished. So this data flow is a new data flow in contrast to Sri Lanka. So in Sri Lanka, they had a existing data flow before implementing the HIS2. But in Timor-Leste, they didn't have that kind of thing. So they started with that new data flow. There was a data flow which is not the one actually we are dealing with at the moment. So start with the individual health record, which is a paper base. Then they prepare individual class list, a list for each class, again paper based. And they're aggregating each class totals into a school sheet, which is aggregate form. And that aggregated from total for school is captured into the system. So that is the data flow. So one single form. So this is the school summary or the totals. Very basic informations are captured at the moment because this is it at the initial stage. Total students and screened and with mobility disorders, BMI, eye health, ear health, skin diseases, oral health, vaccination and referral. So those are the data they are capturing. And they are generating some dashboards based on the data they are captured. So this is about the Timor-Leste case. Finally, as like any other DHIS2 or non-DHIS2 information system, obviously we have to have a very good sustainability plan to sustain these systems. When it comes to education sector or school health, I would say in my experience, the sustainability plan should be more robust and activities may be a bit complicated than health, because we know health now by implementing systems and gaining experiences. So this is a fairly new domain, the education domain, compared to health, so that sustainability planning is very important, which needs to be started even before implementing the system. Capacity building activities and getting all stakeholders involved and considering mobile devices, mobile solutions when possible to ease the data entry activities and ensure sustainability of funding and innovative ideas, and also like new things like integration of AI for data analysis and for predictive analysis are also possible in the context of school health. So I'm going to wind up here because so we are correctly at the end of the time. Thank you very much.
Right, thank you so much. So the good news is we are on time, but since we started 15 minutes late, maybe yeah, we need to give at least 1 or 2 minutes for the audience to ask some questions. So yeah, if you can, yeah, maybe we'll use the microphone so the online participants can.
Yeah, thank you. Thank you from HISP Sri Lanka for this interesting presentation. We are more interested in the education MIS. This is why I'm asking a lot of questions, because we are thinking about something. So you know, the flow within the education system, within the school, it starts from the management, teacher, and then we can see a student, enrollment, exam. So there is a lot of things going on in school when changing from one grade to another. So I know it was a great presentation and you didn't have much time to go to all the details. So I just wanted to know at which extent, if you compare to where the EMIS was not implemented, at which extent the EMIS of DHIS2 have implemented in the education system of Sri Lanka. We can, like in health, we know that which area we